What's going on, everyone? Happy Monday to everyone. Hopefully, everyone is doing well and staying safe. If you had to take a COVID test, hopefully you have tested negative. And if you did test positive, hopefully you have a full and speedy recovery with no long COVID issues, as we are now heading into the EG.5 COVID wave here in the United States. It's time now for the Monday edition of the Pandemic Update for Monday, July 31st, 2023. It is a very busy Monday today. I'm going to try and get through everything that I have in front of me here on my screen, but I got a feeling we're going to probably have to skip a couple things because there's just that much stuff to share with you today. Let's start off with India. India reports another 41 new cases of COVID. Their active case count is at 1,467. It's saying 531,917 deaths, but it's also saying the death toll stood at 531,917. I could have sworn I reported that number was one less yesterday. If you want, go back and check yesterday's wastewater total. I did put I did report on India in that yesterday. Either way, that's what their new total is now. We're not going to fuss over it. Moving on to this. A World Cup player collapsed while doing practice. Linda Caicedo of Colombia suffered a health scare during World Cup's practice. And it says here, as she was jogging around the field, Caicedo clutched her chest and collapsed on the field. Medical staff immediately responded, and they're just saying she was very tired. You know, a lot of the things that they usually say with all these weird happenings and medical emergencies that we're seeing during these sporting events. I mean, it's getting really ridiculous that we keep seeing this many and that no one is the least bit concerned. All right, moving on to this. This is more bad news. The Chicks postponed multiple concerts due to illness. Promise a show y'all deserve, and this was reported. They shared it back on Friday. So, yes, the groups, the Chicks, are currently dealing with an illness. Moving on to this, here's some good news. Got to add some good news in there somewhere today. National panel will explore requiring free COVID tests. Yes, that's right. A panel, in Washington, D.C., is recommending COVID-19 screenings, the first step in requiring insurers to permanently cover the test at no cost to patients. Should that happen, unless you don't have healthcare insurance, which we know there are many out there that don't, there won't be much of an excuse to not get a COVID test if you are experiencing symptoms. So hopefully this goes through. That would be some fantastic news. I'm going to share this out if I didn't already. I'll try and find a site that does not have a paywall or a way to share it without a paywall. And going on to this now, let's go over some numbers from BNO. Then we do have some more news to report on. Weekly U.S. COVID update. Cases, hospitalizations continue to rise. New cases in the United States, 49,769 were reported last week. The average is at 53,419. That's up by 3,052. States reporting 32 out of 50. In the hospital, 8,187. That's up by 237. In the ICU, 1,157. That's up by 32. New deaths, 583. The average is 659. That's actually down by 56, but this is only tweet 1 of 5. It says here the number of new cases continued to rise this week, most notably in Texas, where there was a 72% increase, and New York, where there was a 28% increase. The number of people in the hospital remains relatively low, but increased in 36 states, and I personally think that's going to continue. And then it continues on here. We are also using a new model to estimate the number of cases in states where it's no longer made public. This is based on hospital admissions for the week. We estimate at least 44,344 missing cases, putting the total at 94,113 new cases, up from 84,620. So that's a big increase. We also revised last week's data as Florida released its weekly report 3 days late. This increased last week's numbers by 17,970 cases and 255 deaths. Man, Florida is still having 255 deaths here in the summer of 2023. Come on, Florida. Get your act together. I mean, I get it. There's still deaths happening around the country, but you have to understand something here. This is Florida. This is likely a significant undercount. Now, though be it's a weekly total, this is just ridiculous that they're still having this many deaths, and we're just at the start of this surge. This surge is going to go through all of August, and it probably won't peak in Florida until mid to late August. So the fact that they're having this many deaths already, deaths are usually the last surging indicator, meaning that deaths are usually the last number to rise, and already they're at 255 deaths. That's just totally, totally unacceptable. Alrighty, moving on to this now. Portugal, this has to do with Mpox, exceeds 1,000 cases. New outbreak already has 49 cases. It says the new outbreak is characterized by a different strain from the 2022 outbreak, reflecting the reintroduction of the virus in the highest risk group in Portugal. So that's not good. They are seeing cases of Mpox still. How have any, don't have any to report on in the United States today or this week, but who knows, that could change. But as you've been noticing, we've been doing those wastewater sites, which does detect Mpox. I have not been seeing it detected other than in Youngstown, so we'll have to keep looking. Maybe we might find some more soon. Not hoping not to find any more, but you never know. All right, now to this, some really sad news. Paul Reubens, actor best known as Pee Wee Herman, has died at 70 years old. He rose to his fame. 1980s was a big time for him. That's when Pee Wee Herman really took off, and into the early 90s. And it sounds like he had a cancer diagnosis several years ago, and that is now how he passed away. Again, Paul Reubens, 70 years old. Pee Wee Herman has passed away. Remember the movie Pee-wee's Big Adventure? Now, I wasn't around in the 80s, but I do remember seeing the Pee-wee's Big Adventure movie, so yes, very sad. Alrighty, moving on to this now. Brain fog and other long COVID symptoms are the focus of a new small treatments study. So this is some good news. There's going to be some new studies conducted on brain fog and other long COVID symptoms. And of course, we will not only tweet this out, we will add this to my archives at the website at datareport.info. And of course, when the studies are completed, we'll add them as well. And again, datareport.info is my website. It's a form, it's a message form, but I use some of it like an archive to archive studies that are released out there so you can easily access this information. Already moving on to this now. KJ Hamler is diagnosed with pericarditis, and the Broncos will waive him with NFL designation, and this is now the fifth player that is now out sick so far this season. I say this season, but it's only July 31st. Summer training camps, for football training camp is just only beginning, and now already we have tallied the fifth player that is sick with not a football injury, nothing related to that, not getting injured during the game, but just downright sick and unable to play. So this is a problem. Datareport.info is my website. There's a thread there where I am archiving this, tallying this up. I haven't added this one yet, but I will get to it later on this evening. Now we move on to this. Phil Murphy, who's the governor of New Jersey, is out of country. Sheila Oliver is now receiving medical care. She's the, lieutenant governor. Guess what? There is now a Nicholas Scutari is his name, is now the acting governor of New Jersey. That's right. Phil Murphy's out of the country. Lieutenant governor is currently sick and suddenly hospitalized for an disclosed medical care. And now Nicholas Scutari had to take over for the Phil Murphy, who's not there. I mean, it's just crazy. They actually had to go to the third person in line. Not Phil Murphy, because he's out of the country. Not the next person. And then finally the following person. It's crazy. It's like as if, you're looking at the president, and Kamala Harris isn't available, so they would have to go to the next person in line, which I believe that would be Kevin McCarthy. Yeah, insanity, is it? And meanwhile, we all try to convince ourselves everything is normal. No, nothing is normal. You just saw a whole bunch of news stories that prove things are not normal right now. Moving on to this. Now we take a look at air quality like we like to do every day because, air quality can affect health as well. And there's not really much to talk about here today. The majority of the country is doing pretty well with air quality. Few bad sites up in the Great Lakes and on up across the border into Canada. And there is some increasingly air quality issues that do seem to be getting worse along the California coast, northward up into Oregon, and even Montana and parts of Washington. So that's something we do have to concern ourselves with. And in the east, yes, you're seeing some yellow, but let's be honest, it's much better than it has been as of lately. Speaking of air qualities, this is my daily reminder to you that I do have another channel where I talk nothing but climate and weather. And as you know, air quality can sometimes affect our health, and the climate can affect our health as well. So I have another channel where, I give a weather forecast, as you can see here, and I do a daily climate update. Not certain we'll get one out today. Definitely going to get one out tomorrow, but yep, check out that other channel. It will be posted down below at Climate Data Report. Walgreens, as of the last time I refreshed their page, we did not get an update. Let's refresh it again now. Let's find out, do we get an update from Walgreens today? And no, we do not. Hopefully we will get that in tomorrow. As you know, with wastewater, the wastewater sites across the country, a lot of them are rising. All of the regions are rising. If you did not see yesterday's wastewater update video, it is posted down below. Moving on to this now. Let's take a look at emergency department visits. I'm going to move myself to the left for a little bit here. And you can see the majority of the country is either stable or rising, and in some cases substantially rising, and this is not good to see. We do have northern New England, which is slightly dropping. Maine, Vermont, and New Hampshire. Montana, Wyoming, and Arizona out in the west are dropping at this time. Minnesota, Missouri, and Oklahoma, as you can see here, they did not bother to report, and Puerto Rico did not bother to report either. But look in the south, you see these big rises. It's saying that it's stable here in Pennsylvania. I don't think that's going to last much longer, and I'll show you why I don't think Pennsylvania is going to stay stable much longer in just a little bit when we get to some Pennsylvania data. That's right, I got some data that you have not seen from Pennsylvania in some time. Let's do a few of those wastewater sites now that we like to do that show other things besides COVID, like influenza, Mpox, norovirus, and so on. And today, let's start off by looking in New Jersey. Let's take a look down here near Union Beach, New Jersey. As you can see, coronavirus here, as of the last update on July 26, which is fairly recent, is dropping at this time. Influenza is flat, not an issue. RSV, there was some detected back on July 5th. Now it is no longer an issue. HMPV is flat and not an issue at this time. And check this out. I do not like to see this. So, remember earlier we said we didn't know if there were any other sites that are detecting, we didn't see any other sites that had detected Mpox. Well, look at this. We just found one. Here's one right here. Back on June 28th and on June 30th. And actually on June 30th it got relatively concerning, because you can see here it got this like maroonish red color. That's indicating that there was a high detection of Mpox, and that's not good to see. Norovirus for the site is actually also on the rise at this time, which is something else that's not good to see. So Union Beach, New Jersey did have some detection of Mpox recently. Let's continue on here. We just randomly go through sites, and let's see here. Let's go down to North Carolina. What's going on in Winston-Salem? I think we recently looked at this one, but let's look at it again. And you can see in Winston-Salem, there are rising detections of COVID at this time. Influenza is not an issue. RSV is not an issue. HMPV is not an issue. No Mpox being detected here. Norovirus is dropping at this time. So we're just going to do 2 of these sites for today. And mind you, when I do these videos, I just randomly go along, sometimes off camera. Yes, I will go through and check through the sites, and I do miss a few. And as you just saw, you saw that site that did have a detection of Mpox, and that was a site I had not looked at because, again, I just randomly checked sites. Alrighty, moving on now to the variant proportions. We will hopefully get an update on this on Friday. The all-important EG.5 is the one that we are very concerned about. You can see it here in this cream-like color. It is quickly starting to rise. The variant that is dominating for now is XBB.1.16 at 14.8. EG.5 is up to 11.4%. And again, that's the one I'm most concerned about for the time being. Alright, moving on here to New Jersey. Speaking of Mpox and New Jersey, here's New Jersey for COVID. 204 COVID hospitalizations. That's not a good number because only 64 out of 70 hospitals reported. We can assume if all hospitals reported, this number would likely be higher. 8 people are on a ventilator. In the ICU, 20 people are in the ICU, and they did have 18 discharges since their last update. Moving on now across the Delaware River to Pennsylvania, specifically to Philadelphia, where we do have multiple things to show you. First off, 769 EMS incidents were reported on Sunday. That's still an elevated number. It's not at 800, but it's still just way too high. Also, I have to show you this from Hubbub World and their data. And this is their weekly forecast as of July 31st. Philadelphia and suburbs have very high local prevalence, maxing at 132 area and increasing. Pittsburgh is very high at 31 area, and stabilizing. Central Pennsylvania is moderate but increasing at this time. One of the problems with central Pennsylvania is going to be Center County, Pennsylvania. You have people that will be coming from all over the state within the next couple weeks going back to Penn State University. It's one of the biggest colleges in Pennsylvania. They have a lot of branch campuses throughout the state, but the main campus, it's big. It's tens of thousands of students. It's going to be move-in weekends, so you're going to have people coming from Philadelphia County. You're going to have people coming from Montgomery County. Maybe even down here in Delaware County, where you can see here, the levels are off the charts. And coming up here, and then you'll have people coming from the western, from northeast Pennsylvania. It's a problem, and I think we're going to see a lot of color pop up here in a few weeks in Center County, Pennsylvania. It's not going to be good. COVID's going to be spreading, and that's not the only college. There's colleges all over Pennsylvania, so that is really going to fuel the back to college surge. One last note for Philadelphia. This is something I have not been able to show for a very long time. There are 3 wastewater treatment facilities in Philadelphia here being used here. You have the Northeast Treatment Facility, you have Southeast, and you have Southwest. This is finally updated for the first time in months, and they finally, looks like they've added, finally, as of July, let's see here, yep, July 31st, so it did update again just today. And you can see here, they're finally updating the wastewater information. And you can see here that the only place where it's really rising right now is in the Southwest Water Treatment Facility. And it's not even that big of a rise, which is good to see, but I'm still terribly concerned. You can see here in the Northeast region, looks like there is a small rise up in the Northeast section of Philadelphia. Incidentally, that's my area. And you can see down in the Southeast water treatment facility, it is dropping ever so slightly at this time, but I expect all 3 of these regions will eventually probably have a sustained rise soon. Let's just take a look in at a live look at what's going on in Montgomery County. And as you can see here, it's not terribly busy at this time. This is later than normal for when we would be recording. Here's Chester County, not too bad. Now let's take a look at New York State. 998 new cases reported in New York State today. The positivity is at 10.2%. The 7-day average is at 9.8%. So again, it's over 10% today. That's not good to see. Tomorrow we will get the big first reporting of day of the week for hospitalizations. They ended last week with a rise. As you can see here, it continued to rise in New York State last week. As we zoom this in, you'll see that the number was, here it goes, the number was 558 people in hospital and 60 people in the ICU. Do I think this number, with this current wave that's ongoing, will get above 1,000? I don't know. I don't know that it will go above 1,000 in New York State, but I think what we are likely to see is this wave will eventually, slow down. It won't drop all that much, then the next wave will start in. And I think that's what we're going to see. And in that case, yes, during that period, at some point, yes, it's definitely going to go over 1,000. Not certain it's going to happen with this wave, but you know what? It could. This could only just be the start. We could start seeing this number go up a lot faster, and if we do, that's relatively concerning. That would mean that we're likely missing thousands of cases if it gets to that point. Alrighty, moving on now. I want to show you this, and I'll move myself back to the right now. As you can see here, this is Arizona. Someone was asking, do I have any information for Arizona? Well, this is the best I could do so far. Couldn't find any news stories on Arizona. Back on July 26th, they did add 986 new cases, and 18 deaths were reported to this source of information. And most recently, as of July 30th, 157 people in the hospital and 186 people in the ICU. Texas, for last week, we'll get a new update out of Texas this week. They reported 9,324 cases, and we know that was a significant increase in cases, and we're expecting that to continue again this week. And I suspect Texas will probably continue to rise through about mid to late August. And then at some point, as we tend to see in the South always sees this big rise, and then as you head late August, it seems to level off. Will that be the case this year? I don't know, because, EG.5, it hasn't finished its rise yet, and there's not much immunity to be found out there. A lot of people will not get the booster for whatever reason, and a lot of people have not been infected in a while. So EG.5, it does stand a really good chance at doing some damage to whatever immunity there is. There's not much immunity, but what I'm trying to get at here is it's got a lot of ground. I mean, it could really take off if it wants to because of all these factors. All right, let's take a look at some international cases, and then we'll be done for today. Taking a look here around the world, we do see there's a 0.5% increase in cases. Deaths are down 41%. South Korea, cases are up 19%, and deaths are now up 79%. That's not good to see. Brazil, cases are down 71%. Deaths are down 71%. Hong Kong, cases are down 24%. No deaths reported. Israel, cases are up 3%. Romania, cases are up 20%. And then we come down here to Chile. Cases are now up 57%. Their rise has been increasing. Iran's rise is increasing as well at 179%. Switzerland, cases are up 24%. And we'll end today on Ireland with a 71% drop in cases, and deaths remain flat, 12 versus 12. Alrighty, folks, that does it for today's update. I know there was a lot of stuff to get through. It may have seemed a little bit jumbled today, but I wanted to add as much of it as I could. I actually even left out a few things today because it would have just gone too long. We'll have another update again tomorrow. If you like this content, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you know anyone that needs to see this information, maybe they're getting ready to go back into the office for the first time since this all started, or maybe they have a risky situation coming up, send them my way. They need to know that COVID is not over, and that it is still a thing, and that we are entering another wave right now. So by all means, share this with them. I will see you all again next time. But until I see you again next time during this time of rising cases, please stay safe, everyone. Have a great evening.